Mara Rodriguez Rugel, and I'm going to talk about iris abscess. About the definition, we have two main words that make up the term, the word iris and the word abscess. What is an iris? The iris is a 12 mm diameter structure that functions to regulate the amount of light entering the eye and also separates the eye into anterior and posterior chambers. About abscesses are the accumulation of exudate and the associated inflammatory response within the subcutaneous region. With respect to the hot term, an iris abscess is a rare clinical presentation associated endogenous endophthalmitis that consists in intraocular infections.
And a battle ensues with the result being pus, a mixture of bacteria, immune cells, and dead tissue. So, in response to an injury, the tissue releases small chemicals in the local area called cytokines, like tumor necrosis factor, interleukin 1, interleukin 6, interleukin 17, and chemokines, which attract nearby white blood cells, which are part of the immune system. It's kind of like yelling for help and being heard by the nearby police. In addition to attracting immune cells, the cytokines also dilate nearby capillaries, which brings more blood to the site, and make the capillaries more leaky, so that the white blood cells that do show up can slip out of the blood and get into the tissue more easily. Oftentimes, the first immune cells at the scene are neutrophils, which release chemicals and enzymes that kill bacteria and dissolve pieces of dead cells, creating a pool of dead material. This is a specific type of acute inflammatory response called suppurative inflammation, which simply means that pus is created in the process. From a macroscopic view, this is sometimes referred to as liquefactive necrosis, because the area of dead tissue turns into liquid. As those immune cells get to a point where they can't withstand the environment, they die too, and become part of that pool. Initially, the debris might be intermixed with healthy tissue, but over time it can coalesce into a single area, a process that's often sped up when more immune cells get involved. Around this pool of pus, a wall of fibrinogen, which is the same protein that holds together blood clots, starts to harden into a barrier. Occasionally, sheets of fibrin form septations, creating loculations or pockets of pus within the abscess itself, kind of like an abscess within an abscess. Even though the pus is largely dead material, there are still plenty of live bacteria within the pus, which makes it highly infectious if it gets spread from one place to another.
Applications in medicine. An iris abscess is vinculated with intravenous drug use and bacteremia. Some registered causal agents are Candida albicans and Staphylococcus aureus. Some symptoms include gradually increasing redness and blurry vision. The treatment includes antibiotic broad spectrum and antifungal treatment with voriconazole. This led to significant clinical improvement. Another registered treatment includes 6 weeks of intravenous antibiotic therapy, intraocular vancomycin and ceftazidime, as well as moxifloxacin, prednisolone acetate, and cyclopentolate eye drops.
Infections are treated with antibiotics alone, but in order for antibiotics to work, they need to first reach the bacteria, and that's usually done through the bloodstream. Since abscesses don't have blood vessels inside them, the antibiotics can only diffuse into the abscess, and that's not very effective, especially when dealing with a large abscess. You can imagine it getting to those guys close to the edges, but there's no way it's getting to the bacteria in the middle. That's why the most important treatment for an abscess is incision and drainage. In other words, cutting it open and squeezing out or somehow removing everything inside. Doing this thoroughly is important so that all the septations get removed, and that no parts of the abscess remains intact. Oftentimes there can be a large empty cavity that remains afterwards, and this can easily get reinfected. To prevent that, large abscesses are drained and often packed with gauze to fill the space, until that tissue heals naturally on its own over time. Deeper abscesses sometimes have to be drained with long needles or surgery, depending on the location. Finally, antibiotics are sometimes used even after the drainage to make sure that there are no additional bacteria lingering around.
About pros and cons. Pros. An iris abscess is rare, making this particular case a true diagnostic challenge. Another pro, as a rare disease, this permits investigate and innovate about new treatments. With respect to cons, this disease is often misdiagnosed as it is particularly difficult to identify. And another con, generally the disease occurs in patients who abuse drugs. They do not usually follow the treatment and do not tend to follow up.
Alright, as a quick recap, abscesses are a fun mix of immune cells, pathogens like the bacteria Staphylococcus aureus, and dead tissue. Because there's no blood supply to the middle of an abscess to deliver antibiotics, it usually needs to be cut open so that the pus can drain out.
About the issue obligated in Ecuador, only a few cases have been reported in the literature, notably one secondary to endocarditis caused by Staphylococcus aureus and one after a routine dental cleaning caused by Strep intermedius. No one case is registered in Ecuador. In conclusion, an iris abscess, more than a disease, should be considered an effect caused by an intraocular infection, principally caused by drug abuse and bacteremia. Actually, this effect is rare and just exists a few cases registered. It is not lethal, and its treatments usually include antibiotics or antifungals that has had excellent results. The lack of treatment can incur in a permanent vision damage and a propagation of the infection to other areas. Thank you for your attention.